Good evening, everyone. My name is Robert Hall, project-elect co-chair. We are under the leadership of Pastor Jeffrey Daniel, and as we have said before, we're enthusiastic leaders engaging in changing times. And so one of the things and one of the goals that we set for when we started is we want to give information to the public. We want to be that public conduit. And one of them, one area is definitely healthcare. And we have been talking the last 2 weeks about COVID conversations, these things that have been plaguing our homes, our communities, our nation, our country. And we are here in the company today again of the very well-known Dr. Vernon Rayford, internal medicine, medical doctor, but we have a special guest this afternoon that we are delighted to have, and I'm going to get this right. Certified family nurse practitioner, Tandalaya, Traylor. I got the first thing right. And we know that you specialize in dealing with diabetes, and we're going to definitely get with that. So one of the questions that I had, even off air, they wanted to know how long are we going to be talking about COVID. And so, Dr. Rayford, one of the things that you told me is that the science is still being studied. Mm-hmm. You guys are seeing different things weekly, if not daily. Mm-hmm. So if we were to cut this off now, we're probably going to be cutting crucial information that the people need to have.
Yes. So COVID is still a significant factor that's affecting many aspects of our lives, if not all. It's not the only condition in the community. It's not the only condition that causes death and sickness. But it is a significant infectious disease that we're going to talk about it as we learn new things about it. If we stop talking about coronavirus now, there's a chance that for a month down the road, many of the things that we've said, we may have to change those things and correct those things because we're still learning. I think it's still pretty impactful to talk about coronavirus, particularly the different aspects, particularly how coronavirus has latched on to some of the significant conditions in the community like diabetes and made it even much more of a factor, and how there's an interplay between that and some of the other factors. So, my hope is that, we'll be able to talk about it as much as we need to. Right now, we need to, as much as we can. We're still very much in the, at best, we're in the last part of the beginning of coronavirus, hoping to transition to the middle and then the end of coronavirus. But we're still real early in this pandemic.
So the death rate is still rising.
Mm-hmm.
I don't know if we are at an all-time high. Did we hit a record today of the death rates in the nation?
So yesterday was a record, and the way these records go, they're broken a day or 2 days later. Death rates in terms of the United States and the state of Mississippi reported the most deaths in a single day, almost 100 deaths. So we're still into the very kind of the very tough part of it. We're still trying to find a way to ramp up vaccinations to really help us, as in addition to the other public health measures, the masking, the distance, the hand washing. So we have a ways to go. There's a lot more people that need to get the message about ways that we can protect ourselves and each other from coronavirus. We hope that enough vaccinations have been given to make, February and March look a lot better than December and January. But that's only if people get the vaccinations.
Wow, well said. Now, one of the things we talked about last week, and we get more detail, is underlining factors. Mm-hmm. And that brings us to nurse practitioner Tandalaya Traylor. How long have you been practicing? I know it's been a few years now.
Yes, for 13 years.
13 years.
Yes.
Wow, and you look about 25.
Well,
so I can get some points for
you.
that.
Thank you.
So you are a specialist in diabetes.
Yes.
And we know diabetes run rapid in the community, especially in the African American community.
Correct.
Can you tell me the combination with maybe attracting COVID and having diabetes, and how that may be a little bit worse on a normal person if they contract COVID-19?
Yes, I do. And I want to first just thank you and also Dr. Rayford for inviting me here tonight. And conversations like this are so critical with the increase in all of the cases. And so I thank you for that. Before we jump into that, I'd like to just talk about what diabetes is, because I don't want to assume that all of the viewers know what diabetes is. There are 3 different types of diabetes. There's type 1, type 2, and then also gestational diabetes. Type 1 diabetes means that your body does not produce any insulin, and that can cause your blood sugars to be increased. Type 2, which is more common in our area, means that your body is not using insulin correctly. So the type 2, you maybe can control it with diet and exercise and pills, but with type 1, you really have to be on insulin, whether it's injections or by insulin pump. And gestational diabetes means diabetes with pregnancy. So just to bring that to perspective, diabetes alone without COVID can increase the risk of stroke, heart attack. It can increase your risk of kidney failure, also neuropathy. Neuropathy is when you can have numbness and tingling to your hands or feet to the point where you can't feel. And this is even without COVID. This is just complication of diabetes alone. It can also cause problems with vision loss. It can cause bleeding behind the eyes, glaucoma. Those are things that can be increased risk factors without COVID on top of that. But when you add COVID to diabetes that's uncontrolled, that does increase the risk factors of complications. And so it definitely does complicate things when it's not controlled.
So going back to, and I'm glad you brought it up to specify, because we've been hearing diabetes for years, and I really didn't realize there was 3 types.
Okay.
So is that rapid in the African American community? Is it rapid around males, females, or who's more prone to diabetes?
I would say definitely it is a disease that is increased in our African American community, and obesity plays a big part in that. And some of it is also hereditary, and so a lot of our diet and exercise, when that is a challenge for some patients, that is an outcome that patients will develop, is type 2 diabetes.
And so, Dr. Rayford, with what nurse practitioner Tandalaya is talking about, is that something that you see often? Is that a diabetes test that they would get before COVID or during COVID, or how is that really diagnosed? If I were to come to you and I would think that I'm a healthy 20-some-year-old male. No, I'm just kidding. But I'm thinking that anybody can develop diabetes, right?
So usually diabetes is diagnosed 2 scenarios: in people with symptoms, and usually those are characteristic symptoms of diabetes. They're peeing a lot, they're thirsty a lot, they're losing weight without trying, they're feeling fatigued, they may have blurred vision, or people don't have symptoms at all. And that's probably the most common situation that people can be diagnosed. In that scenario, those people are screened. So screening is when you look for a problem before it's potentially causing a lot of damage. So if you meet some of the risk factors for diabetes, Ms. Traylor said obesity. So obesity, family history, age, so 45 and older. Women, if they've had a history of gestational diabetes, they actually have a risk for type 2 diabetes. Being a member of a racial and ethnic minority, so Hispanic American, Mexican American, Native American, African Americans, that's a group that you'd also want to screen. And again, screening, we usually screen people with one of a few blood tests. And if the blood test is abnormal, once it's confirmed, then that person's managed for the specific type of diabetes. Most people with type 2 diabetes will probably get the diagnosis through screening. Most people with type 1 diabetes will be diagnosed through they're having symptoms and being really sick. Women, there's routine screening for gestational diabetes, part of standard of care for pregnancy. So women with gestational diabetes are diagnosed during screening. We know there's a significant impact on the developing baby and pregnancy outcomes. So that's why screening is really important for gestational diabetes. So, if you came to me and you met the criteria, we would offer some form of screening.
Okay. Well, so those are good points, which bring me to one other thing. Now, certified family nurse practitioner, and I know he brought up 45 or older. Now, what about kids? And he mentioned even early pregnancy or something like that. Does that affect a child and even younger siblings in the family? Can diabetes do that?
Sure, yes, it can. And actually, for our clinic at the Diabetes Treatment Center, we see patients that are 18 and older, but there has been an increase of childhood diabetes. And so our children now are more overweight, they're less active. Not all kids, but a lot of our children now have those issues, and because of the family dynamics, if they're eating out fast food, if that's just the nature of that family, a lot of times we will see that our kids are more overweight and can potentially develop type 2 diabetes very early.
And Robert, if I can add,
No, please do.
that's actually a very alarming statistic in terms of the number of teens and adolescents that are being diagnosed with type 2 diabetes. So we previously thought that type 1 diabetes, we called it childhood diabetes, type 2 was adult onset. What we're actually finding is an alarming increase in type 2 diabetes in teens and adolescents, particularly black girls. And that's one of the fastest groups of people being diagnosed with type 2 diabetes in teens and adolescents. Their diabetes experience is much different from their mother's and grandmother's experience, so there's a strong family history. The teenager who's diagnosed with type 2 diabetes has much more risk, because if your body is in the insulin not working right, type 2 diabetes, functioning that way, you're at a higher risk of complications in your youth. So 20s and 30-year-olds having issues with their eyes and neuropathies, and 20s and 30-year-olds having issues with their kidneys, strokes and heart attacks happening to that young group. So it's a really, really important thing for families to know that, if there's diabetes that runs in your family, to pay really close attention to your teenagers and adolescents, particularly the young black girls. And we also know that there's some things that can prevent diabetes for people who are at high risk. So diabetes is not an automatic diagnosis. That there are things and programs that can help people who are at high risk for diabetes, particularly those who have strong family history, maybe also obesity, or there's people who are in a in-between status called prediabetes. Those people have a blood sugar that's higher than normal but not high enough for type 2 diabetes. We know that when you do interventions for those people, and those interventions are a little bit of weight loss that most people would be disappointed in, regular physical activity, those two together can reduce a person's risk for type 2 diabetes much more than a medication can.
So I heard about the diet, and I have a habit of running by Burger Kings just about every other day, just for a quick meal. How can I change that habit? I mean, what are some foods for someone like me, always on the go, to grab without having to grab those fries or that burger or something? And I said that to say this: we know that COVID is still running rapid, and diabetes gives you those underlying factors that make it a little worse. So what are those little things that someone could start changing now, and whichever one you want to direct that question to?
So I'll jump in. And so what seems like something easy to just tell you, hey, quit eating Burger King, eat less, exercise more.
Go to McDonald's?
So it's probably the hardest thing, because there's a lot of automatic actions that you do during your day, things that don't occupy your entire attention. And we actually can't kind of, pay 100% attention on our food. That's just too much space in your brain. Like, you will get fatigued, every time you say, don't eat that fry, don't eat that fry. And so with behavioral change, it's, for you, it's figuring out kind of what you want to change. And most people who are successful focus on something that's simple and doable. And so you may not change the Burger King aspect because work only allows a trip to Burger King. You may change a choice that you make in the context of that Burger King meal. And so that might be a different choice in that context. And as you kind of keep ticking away those choices, you may find that sometime down the road, you're not going to Burger King. And instead of the head-on approach, I'm just not going to go to Burger King. Well, you might need to drive a different way, because if you see Burger King, there's some automatic processes. There's some automatic processes that's going to go on, but again, it's a digging and figuring out kind of what change, making the change small enough for you to tackle, and just kind of keep tackling and snowballing the changes in terms of of that.
So, practitioner Traylor, Dr. Rayford mentioned a lot of things that would let me know, hey, I may have prediabetes or whatever. And then he said you may not have any symptoms. So what is something that we can watch out for that may be changing or we're not feeling well? What are some of the things that you see more often before we are diagnosed with diabetes?
Well, when patients come to us, it's a referral, and so they typically will already have the diagnosis of diabetes. What I have seen with my patients is that some of them have symptoms and some don't, but I would encourage, this is a good point I would like to drive to the viewers tonight, is to keep appointments. This is going to be a vital time to keep your appointments with your provider, and at this time, there are so many variety of ways to do your visits with your provider. You have a virtual visit, which means that you can do that in the privacy of your own home. You have a telephone option. You have even going into the clinic. So at this time, you have so many ways where you can get your lab work done. There are some clinics that even do a drive-by and will do your lab without you getting out of the vehicle. So we are trying to make it as providers as convenient for you all at home, and for those that may be watching, to make sure that your health is being currently checked. And when you find out those things, I would say follow the recommendations and guidelines of your provider. When they make recommendations, a lot of times I have seen that where patients have maxed out all of their medication as far as their pills or their options, and maybe insulin will be the next thing. They typically don't want to do insulin, but if it can keep you out of the hospital and out of the emergency room until you're able to make some life changes with diet and exercise, then those are things that I would recommend on doing.
Good information. Again, we're talking about COVID conversations, but we're kind of sidelining it with diabetes, because we know diabetes have a lot of underlying factors that dealing with our blood pressure, our eyes, being maybe a little bit obese. All these things play a factor. So here's my question. Mm-hmm. You got, and I'm one of them, I can say this, but I want to ask her about the ladies. These hard-headed men, I'm just going to be real.
Yeah.
We are less likely when we feel bad or whatever to try and go see a medical professional to figure out what's wrong. Mm-hmm. And a lot of times I think we wait too long. Mm-hmm. What are the consequences to waiting too long when you think you may have symptoms of diabetes?
Yeah, so there's very significant consequences of uncontrolled diabetes. So diabetes is one of those diseases where there's immediate dangers. And so that person who's symptomatic, so they actually have an immediate danger of dying. Kind of the most consequential complication is dying, with symptomatic high blood sugar. Less consequential things, their eyes, blurred vision. So many people get their sugars checked because their glasses prescription is changing rapidly, and their eye doctor is recommending they get checked for their blood sugar. Unexplained weight loss, particularly people who've had obesity, just start losing weight, but they don't feel great with the weight loss, that they feel horrible, extreme fatigue, they're thirsty, urination a lot, significant amount. And then, like I say, there's very significant complications. Some people can have neuropathy symptoms, so numbness, tingling, burning, that goes along with those high blood sugars. So more of the short term. Now, long term, there's most organs are affected by the high blood sugars,
Yes.
and so a consequence of the blood sugars effect on the blood vessels, particularly the arteries. And so those people can have issues where blindness, issues with stroke, definitely raises your risk of a heart attack. High risk of amputations, which is something that's happening frequently around here, and it doesn't have to happen. So Mississippi, one of the states that lead, unfortunately, in amputations. And so diabetes is a common cause. You may hear families have this generational story of my relative has diabetes and they got their leg cut off. And, and that may frame many people's perception. So some men may not be open to diabetes because their only experience is that relative with multiple amputations or the relative on dialysis. So those are some of the long-term complications, and we're just real. Speaking to men, your private parts don't work good when your sugars are high. And sometimes that consequence doesn't go away. And so, some people, that may be an important motivator for men that, at some point, arteries arteries work down there too. So, that's if that can motivate some men to take it seriously, that for some men, once that point of no return has been crossed, that return of function that may not come back, even if the diabetes gets under control.
Is that usually with type 2, or can that happen with type 1?
It can happen with type 1. It's it's a consequence of the high blood sugars. So when your blood sugars are high and uncontrolled, it leads to a lot of the complications. People with type 1 are at risk for another complication. That's when they're in this severe insulin deficient state where high levels of acid builds up in the blood, and they're at a high risk of dying from that, something we call DKA, diabetic ketoacidosis. Most common in people with type 1, but it's something that I was surprised to see here. I've seen a lot of that with people who have type 2 diabetes. That I didn't see that in Boston. I didn't see that in Nashville. I didn't see people with type 2 diabetes go into this severe insulin resistant state to the point where now their body's looking like it's severe insulin deficient. And they have this presentation just like those people with type 1 diabetes. Yeah, the consequences of high sugar is similar for people with type 1 and type 2. There's some other consequences like DKA for many people with type 1. When
you say DKA,
the diabetic ketoacidosis. So where you build up that high acid level because you're in a severe insulin deficient state.
Okay.
And that's the part that harms people more so than the blood sugar. At that point, the blood sugar is a problem,
Right.
but the 5-alarm fire is the acid level that's building up in your body. It can be toxic to the brains. People can die. People can have comas. And unfortunately, people are dying. And there's a good number of people who are still dying from diabetes. Pre-coronavirus, there's a good number of people who are dying from diabetes during coronavirus. And so there's a significant need to identify diabetes, to manage it early, prevent as much diabetes as we can.
Wow. So are those symptoms the same in females as well, practitioner?
Yes. Patients that have type 1 diabetes and type 2, like Dr. Rayford was saying, we have seen DKA, and like he said, that's an emergency. That is something. Signs and symptoms of that would be nausea, vomiting. For patients that have DKA or type 1, you can do what's called ketone testing at home, and those are strips that you can purchase over the counter at the pharmacy. You urinate in a cup or you pee in a cup, and on the back of that tube there's a color chart, and you match that stick up to the color, and it will tell you if you're spilling ketones. A lot of patients are doing intermittent fasting and keto diets and things of that nature. But if you're spilling ketones and you're a diabetic and blood sugars are extremely high, that is an emergent case. And I think that drives a good point where we can talk about emergency visits, because right now we do at our clinic, we try to streamline patients and prevent emergency room visits or hospitalizations. A lot of things we can handle at home. As long as you're communicating with your provider, we can help. We can help you stay out of those areas. A 200 blood sugar is not an emergency. We can handle that if it's not subgroup with other symptoms. So I will say that the emergency room, is definitely an option. However, I recommend patients to go to urgent care. One is because urgent care, they close, so you know that you're not going to be waiting all night or all in the morning. You will get treated, and if they feel necessary, you'll be transferred to the emergency room. So I strongly recommend urgent care clinics for things of that nature. As far as with COVID in the outpatient setting, I do cover at urgent care as well some. Diabetes, if you're a diabetic, a lot of times they treat COVID with steroids. And steroids can increase your blood sugars, maybe 200, 300, 400. So it's very important to communicate with your provider. And when we talk about communicating, if you see someone in the North Mississippi Medical System, there is an app that is called My Connection. I recommend everybody, if you're listening or have a provider, sign up for that app. If you have Facebook and you're watching, you can sign up for the My Connection. It's free. It's a great tool for you to communicate with your provider. You can type in questions. You can request refills. You can change appointments, schedule appointments. It's a great tool to use. And I just recommend doing that just as an extra layer of communication. And so that just kind of drives my point to also with the steroid therapy, you may require a little bit of short-term insulin if your blood sugars increase. I wouldn't say just totally, not do that, because again, you can use what's called a sliding scale, and that is just depending on what your blood sugar check is, it will tell you how much insulin you need, if any at all. And that's sometimes used until the steroid clears from your system or till your symptoms have completely resolved. So as a diabetic, you may require, if you've tested positive for COVID, a short-term sliding scale insulin.
That is great information. And for those of you out there that may be just joining, we're talking to Dr. Vernon Rayford and nurse practitioner Tandalaya Traylor. And we're just talking in lines of the COVID conversation, but we're using the underlying factors of sugar diabetes. And which bring me to a couple more questions for you, Doc. Mm-hmm. She mentioned steroid treatments and insulin, and I'm just going to say a pill. She didn't say that. What are the side effects of those for someone who may develop diabetes? Are there side effects to those treatments?
So there's side effects with every treatment. It's probably too many to, there's side effects. The more common side effects that can happen with therapies to bring down blood sugar is obviously having a blood sugar that's too low. Some of those medicines can be associated with weight gain. Some of those medicines that we use to treat diabetes, some of the newer medicines may be associated with weight loss, which may be a problem for some people. Some medicines may be associated with a slight increased risk of urinary tract infections or yeast infections. Some of the newer medicines that are out there. Let me think. And there's kind of the typical allergies. There's one common medicine, metformin, which is used often for type 2 diabetes. Side effects in the stomach, so upset stomach, acid reflux, diarrhea, stomach discomfort can be associated with that. Usually, although these medicines may have side effects, the complications of diabetes and all the risk that diabetes brings, make the decision on the medicine a lot different. At the upside of treating diabetes and preventing complications, it's a strong, compelling reason to use those medicines, even if there are some side effects that, may be significant for some, but is not as significant as the complications. There's the diabetes medicine that people normally take outside the hospital. When a person's admitted to the hospital, we usually use insulin to control people's blood sugar. So there are some people who are not on insulin outside the hospital. You get admitted to the hospital, say for coronavirus or something else, and in the hospital they're managed with insulin. That doesn't mean that they're going to forever be on insulin. It means that in the hospital, insulin is a more reliable way to manage blood sugar because of the predictability in terms of how fast it can work, how effective it can work. And there are some hospital conditions that can make by mouth diabetes medicine more risky, and insulin doesn't have that consideration. And so some people have a change in how they're managing diabetes that starts in a hospitalization, particularly with coronavirus. So Ms. Traylor mentioned steroids in the outpatient setting. If someone's admitted to the hospital with severe coronavirus, they're given steroids at a significant dose. And high blood sugar is a common consequence of that. The sickest people with coronavirus, those people who are on the breathing machines, who've been on there for a while, so they're now doing nutrition through a tube into their stomach. That's also something that's associated with higher blood sugar. So another reason for more intensive management of blood sugars. We do know that most people in the hospital, we do know that high blood sugars when they're in the hospital can complicate their care. In some groups, particularly people who've had chest surgery, a high blood sugar can increase the risk of complications. And so we're really aggressive. So there are people who have had chest surgery, heart bypasses, lung surgery, where they're managed intensively because we know that there's a clear connection between blood sugar levels and the risk of chest wound infections. Some people with wounds, some surgical procedures, those people have more complications if the blood sugars are high. People who are in it for other reasons, stroke, heart attacks, high blood sugars can complicate those and make those people have a higher risk of complications. So on the hospital side, we may be more intensive for many people. So what would happen if you're in the hospital and your regimen is really intense, coordinating with your primary care provider, nurse practitioner, or physician as soon as you get out to figure out how to continue your diabetes care for when you're released from the hospital.
Wow, I'm constantly learning, and I thought I knew just a little bit. But obviously, the thing is what I'm learning tonight is that, yes, COVID is there, because we learned last week is, if it, get the, runny nose or coughing or sniffing, just assume you have COVID until it's proven differently. So now with the diabetes, if I take the vaccination, and I wanted to get into that. I know there's 3 out there. We're talking Pfizer, Moderna.
Well, 2 so far.
2 more? 2 so far?
2 so far, and they're talking about a potential one that has first, so the Janssen and Johnson vaccine. Janssen is the JAN one. So they're talking about their vaccine as a different mechanism. It's just released some preliminary data on the vaccine. They've studied a single shot. They've studied varying doses of the shot. It works a different way than the 2 existing vaccines that are authorized, but we're waiting to hear. I'm doubtful that it'll be authorized before February. So the 2 ones right now, so 2 ones right now, and I think the rest of your question was, is there any specific risk of the vaccines to people with diabetes? And the answer is, in the studies, it doesn't look like people with diabetes are at a particular risk of any complication from the vaccine. There's still, the side effects of the vaccine are more related to the immune system kicking in and revving up. Is more common in people who are younger than 55. So tiredness, headache, muscle aches. A small but significant group may have fever, but it doesn't cause cough. It doesn't cause taste and smell change. So if you got that, you got coronavirus. Don't matter that you got the vaccine today. So if you're short of breath, they didn't describe shortness of breath being a side effect of the vaccine. So there's some overlap. Fevers, chills, muscle aches, fever could be the vaccine. But shortness of breath, dry cough, loss of taste and smell, you have coronavirus. Get it, get checked out, isolate yourself. But no special, there's been no special extra risk for those people with diabetes, but there is extra benefit. So I don't think we said it early on, but I'm going to say it. It doesn't look like having diabetes raises your risk of getting infected. So, but it is a significant risk factor for having severe coronavirus and for dying. So people with diabetes are at a higher risk of dying from coronavirus. So if you look at all the people who died in Mississippi, diabetes is the third most common comorbidity that occurs in the people who died of coronavirus. So there's heart disease, high blood pressure, and then there's diabetes. And so it's a significant risk factor for dying from coronavirus. So you add that to all of the complications associated with diabetes, that increased risk of severe coronavirus and death, complicated by, especially on the in-hospital side, what we're doing to treat people, the high-dose steroids. You're actually having people with diabetes who are given medicines to try to save their lives, but will raise their sugars. And so it's this difficult balance that if you have an opportunity to manage your diabetes well, do it. Manage it well. Get the vaccine as soon as you're eligible, particularly eligibility. So that's changed. So the governor has been announcing eligibility changes now. So right now, it's age 65 and older without anything extra, or 18 to 64 if you have a chronic condition. Diabetes is one of those chronic conditions. So you don't have to ask your doctor if you're eligible if you're between 18 and 64 and you have diabetes. What we don't know is, so right now the state health department is the only one in this area that's offering the vaccines that I know of. So there's a sign up that you go through, and in the questions, they're just asking you to declare whether you're a healthcare worker, how old you are, and whether or not you have some of those conditions. You don't have to pick it.
Online?
It is. It's something online, and later I will just share the link. It's been heavily trafficked because now there's a lot of people who are on because it was opened up. Yeah, it was opened up, and so there is a backlog. I anticipate that health systems, particularly North Mississippi, is going to be a part of the vaccine distribution. We just don't know exactly what that's going to look like. So be on the lookout. There's a social media page from North Mississippi Health Services to kind of follow to see what process we're going to have to deliver vaccines to our patients in the community. But simply put, no extra risk for people with diabetes from the vaccine. Significant benefit for people with diabetes with the vaccine.
I just heard, are they booked up right now through February as far as the vaccines are concerned?
Yeah.
And talking about the vaccines, I wanted to add something too with diabetes. One of the recommendations, not only for the COVID vaccine, but for pneumonia as well, because a lot of times COVID can develop into have a complication of pneumonia. Some people view pneumonia vaccine as an old person's vaccine. I don't need that because I'm too young. But if you have diabetes, regardless if it's controlled or not, it's recommended at age 18 actually to get your pneumonia vaccine. And I also support the flu vaccine as well. So anything that can help prevent the symptoms, I strongly recommend that for diabetic patients. While we were talking about the vaccine, something that I think is important to share that I thought was interesting was a patient's family member received the COVID vaccine, and in their mind, they no longer felt that they needed to wear a mask because they felt that I am protected from COVID. That you still want to follow the CDC guidelines. The vaccine does not prevent you from getting COVID. It does not prevent you from spreading it, but it helps decrease the symptoms. And so that's one thing that I would like to share with the viewers tonight is that when you get vaccinated, it does not take away the risk, the CDC guidelines of wearing your mask. I thought that was interesting.
Very good point. Very good point. And again, we're talking here with Dr. Vernon Rayford and nurse practitioner Tandalaya Traylor. And so I would like to ask do we have any questions from the audience? Anything that any question you want to upload, Dr. Rayford and Ms. Traylor will answer those even after we are off air. And you've done a very good job with that. So one of the things that came up in my mind with the vaccine is while you were talking. And I know we're rolling up on 45 minutes. Is that something, and we're informing here, is that something else we need, Kenneth? Okay, so we're rolling up on 45 minutes here. So at this point in closing, and I'd ask you, Ms. Traylor, what can you offer our audience right now? I mean, with COVID, people dying, the sickness. One thing that bothers me is we have ill people in the hospital and their family can't visit and they're FaceTiming, and psychologically, that's got to be tough. So what can you offer in closing?
Okay, great question. What I would recommend is definitely self-care. Self-care is what you can do on your own. Do the best that you can. I also recommend getting out and getting some exercise, getting outside of the house, get some fresh air. You've got to clear your mind. I would say take a break from watching the news as far as if that's just something that's overwhelming to you and stressing you out. Just take a break from that. Another thing I would recommend as far as diabetes is making sure that you're monitoring your blood sugars. If it's been a while since you've checked your blood sugars, be sure that if you grab that bottle of strips, if it's been months to a year, check the expiration date. A lot of patients don't realize that strips have an expiration date. You'll still get a reading, but it may not be as accurate. If you're having issues with affording your medicine, I know it can be tough times right now for patients who are maybe not employed or working as much as they used to. There are generics that are available. If you can't afford your medicine, let your provider know. Don't wait until that next visit and they don't realize it. Until then, there are generics. I also like to put this out here in closing. You can go to insulinhelp.org. That is a website that if you're having trouble with your paying for insulin, those are some resources that are free for you, and they can get insulin maybe for $35. There are some requirements for that. Even at our clinic at Diabetes Treatment Center, if you don't have insurance, we have a program called Diabetes Assistance Fund where we provide diabetic education and diabetic supplies for you. So there are resources. You have to just reach out after this is over. I can always give more information in regards to that, and just doing the best that you can. We're not asking you all to be perfect, but communicate with your provider. If you don't have insurance and you have diabetes, I would say reach out to our clinic or establish a primary care provider, and we can get you on the right track.
So there's resources out there that can be found. Okay.
Yes.
And I hope that when someone listens to this or play it back, they would replay and listen to what you said. One last thing for you, the app that I can connect with my service provider. I think that really stood out. Can you explain that one more time?
Yes,
before we
it's
go?
called My Connection app. And if you are a patient and if you see a provider in the North Mississippi Medical Clinic, you can access that. It's really quick. You can have your code you can do it over your text, over email, a website. It's very easy to do, and you automatically can see all of your lab results. You can have your medical records. If you need a letter typed, you will have access to that letter, and it's a great tool. I strongly recommend the My Connection app.
Wow, thank you. And Dr. Rayford,
Yeah.
what do you have for closing for us this time? The last two has been dynamic.
So for close, so there's a question about whether there's increased risk for people with sickle cell with the vaccine. It doesn't look like they've really designated in the studies how many people had sickle cell. Probably a smaller group, but certainly a smaller group. But sickle cell is listed as one of those conditions that the vaccine is strongly recommended for. And so, what I will say is, it's still recommended because sickle cell is another condition that is risky. Numbers-wise, the numbers aren't as high as diabetes, but it is a significant disease that affects members of the African American community. And there's a lot of consequences and complications from sickle cell. That's a group that I also strongly encourage to get the vaccine, as soon as they can. It looks like, doesn't look like, informally that people with sickle cell are worse off with the vaccine, so I strongly encourage those people to get that. My closing would be, these COVID conversations are really, really important. I've enjoyed it, really communicating the health issues and communicating the information as we know it. We know that we're learning in real time, and that information will change. I think there's a need for more COVID conversations. There's a lot to be talked about. I also want to acknowledge that coronavirus isn't the only disease or issue in our community, but we can give the appropriate attention to coronavirus and diabetes without diminishing anything. So there's no either or. There's no, coronavirus is doing this, but what about undiagnosed cancer? That's a problem too. Right. So addressing diabetes and making sure that we're identifying it, we're managing it, we're preventing it is really important for our community's long-term health. Mm-hmm. It's also important for our short-term health as a risk factor for coronavirus. So as you think of some of the other chronic conditions like high blood pressure and heart disease, and there may be some topics that we'll bring later on, what we're saying is, we want to get the information out for, short-term health benefit, but also laying the foundation for a healthy community. A healthy community, is one that now we can tackle some of the other things. Just kind of being healthy can be a prerequisite for the rest of the hard work that we have to do. So take coronavirus seriously, take diabetes seriously. Really focus on those things that you can do to protect yourselves, as well as protect the community. The vaccine is a part of it. I strongly encourage people to consider it, that it's a part of it. There's some hesitance with the vaccine. There's a unfortunate history in the community of exploitation and, just unfair treatment. There's some distrust of the government and the medical establishment. But you have providers like me and Ms. Traylor who, we're saying, look, we've looked at the data for ourselves. We made the decision for ourselves to get the vaccine, and we know that it's a significant tool in our fight for coronavirus. It's not the only tool, so I don't want people to leave to tell them just get the vaccine and everything will be. No, the vaccine is part of what we're going to need. Masking, the distance, the hand washing, keeping things small, doing things outside, all of that's going to be what we need to get back to what normal looked like. So I go back to take coronavirus seriously, do all that you can to protect yourselves, your loved ones, and even people you don't know. And if you have questions, let us know. If you have suggestions for topics that you want to hear, add that to our website. We also want you to share this. So, we want to make sure that the information is out there. And we want to make sure that, we want to make sure the information is out there. We want to make sure that, we are reaching the most people.
Wow, very, very, very well said. I just want to take this time I want to appreciate both of you. And I said this last time, I said again, I know you both have spouses, you have families, you obviously worked all day, but you're taking time now to do the extra part for your community. And that tells me that you don't only, care for your families, but you care for the community and want to see that better. So this is great information. I mean, we have 2 medical professionals right here in our community, and they're sharing this information, which is invaluable in order to keep us safe and save lives. And so, Dr. Rayford, I know you're the newest member of Project Elect. We appreciate you, and who knows what the future may hold.
Okay.
So I just want to thank you. My name is Robert Hall again. This is Project Elect. We're looking to be a conduit for information in the community, and we hope to see you again soon. We want to thank Kenneth Wheeler for the hospital and using this great room again. We want to thank Maurice Schompert, who is behind the scenes working hard and keeping those things going. So once again, I don't know when we'll come back, but as information develops, we're going to be tagging these medical professions for more information. Go on our Facebook, look at it, share it. I can't say that enough. Please share this. And we'll be back soon. Thank you and good night.